Hi folks, in our CPT books, we have general section first. Under general section, we have fine needle aspiration biopsy. So before going to this section, we need to know the medical necessity for this fine needle aspiration biopsy. So what is meant by fine needle aspiration biopsy? So a fine needle aspiration biopsy is performed when material is aspirated with a fine needle and the cells are examined cytologically. We need to know the word cytologically also here. So what is meant by cytology? Cytology is the exam of a single cell type as often found in the liquid specimen. So basically fine needle aspirations are fluid specimens. So as you know, aspiration means collection of cells using a needle. So it is mainly used to diagnosis or screen for cancer. It is also used to screen for fetal abnormalities or pap smears to diagnose infectious organisms and in other screening and diagnostic areas. So usually these fine needle aspirations are performed using 22 gauge size to 25 gauge size small size needles. So here we need to know one more biopsy technique, which is core needle biopsy. What is meant by core needle biopsy? A core needle biopsy is typically performed with a larger bore needle to obtain a core sample of tissue for histopathological evaluation. So here we need to know the word histopathological. So what is meant by histopathology? So basically, histopathology means the study of changes in tissues caused by disease. So usually these core biopsy needles are like biopsies performed by 14, 16 and 18 gauges needles, which are very large circumference needles. So before doing any procedure, we need to check the medical necessity for that procedure. Here, if you are doing fine needle aspiration biopsy, for what purpose we are doing that biopsy? Usually we will do fine needle aspirations biopsies for masses or nodules of the thyroid, breast masses or suspicious kidney growth or biopsies of the lung. So here fine needle aspiration biopsy procedures are performed with or without imaging guidance. So before doing this, you need to check what is the purpose of this imaging guidance here. So basically, aspiration biopsies are performed under the skin, means physician can't find the mass or cyst inside the body, means inside the skin. So he need to use the imaging guidance. If it is a mass like growth, physician can diagnose visually, so seeing with naked eyes. But if it is a small cyst or nodules inside the body, he can't see with naked eyes. So he need to use the imaging guidance. In fine needle biopsy aspirations, imaging guidance is included in all CPT codes, which we are going to learn down. So whenever we perform these fine needle biopsies, we have few guidelines, which we are going to learn now. So when more than one fine needle biopsy is performed on separate lesions at the same session, same day, same imaging modality. Use the appropriate imaging modality add-on code for the second and subsequent lesions. When more than one fine needle biopsy is performed on separate lesions, same session, same day, using different imaging modalities, report the corresponding primary code with modifier 15 and for each additional imaging modality and corresponding add-on codes for subsequent lesion samples. This instruction applies regardless of whether the lesions are ipsilateral or contralateral. I think you know that ipsilateral means same side of the body. Contralateral means opposite side of the body to each other and or whether they are in the same or different organs or structures. So when fine needle biopsy and core needle biopsy both are performed on same lesion, same session, same day using the same type of imaging guidance, do not separately remove the imaging guidance for core needle biopsy. When fine needle biopsy is performed on one lesion and core needle biopsy is performed on a separate lesion, same session, same day using the same type of imaging guidance, both the core needle biopsy and the imaging guidance for the core needle biopsy may be reported separately with 59 modifier. So when fine needle biopsy is performed on one lesion and core needle biopsy is performed on a separate lesion, same session, same day, using different types of imaging guidance. Both the core needle biopsy and the imaging guidance for the core needle biopsy may be reported with uh, 59 modifier, which we are going to learn now. Whenever we find a operative report for biopsies, we need to check the following things first. Is the aspiration procedure specified as fine needle aspiration? So we need to check whether the aspiration technique is used using the fine needle or core biopsy, as we need to check the gauge of the needle. So second one is what type of imaging guidance, if any, is performed. So as you know that imaging guidance is mandatory for these fine needle aspirations. So third one is a specimen being obtained. So we need to check whether physician obtained the specimen or not. Locate other codes if the answer to any of the following questions is yes. Is the specimen being evaluated? So we need to use laboratory codes here. So does the aspirate consist of orbital contents? If it is yes, we need to use I codes. So like I biopsy section. Is the transendoscopic method used to obtain the aspirate from the esophagus, stomach, duodenum, or colon, like EGDs? Using EGDs also, physician aspirate the fluids from the gastrointestinal system. Last and final, most important is a percutaneous or core needle biopsy performed. Usually, these fine needle aspirations are percutaneous procedure. So, core needle biopsy is something different. So, we will go by code now. So 10021 fine needle aspiration biopsy without imaging guidance, first lesion. Here the provider performs a fine needle aspiration, a diagnostic procedure that involves collecting a small number of cells, a small amount of tissue or fluid from a cyst or mass using a specialized needle or syringe. Report this code for the first lesion biopsy. So as you know, it is direct. So if the physician performs fine needle aspiration without any imaging guidance, we need to use 100 to 1. So for the first lesion, so if the physician performs more than one lesion, we need to course 10004 for each additional lesion. This is also without imaging guidance. You can see when a procedure is conducted percutaneously, the physician can't see into the body. Therefore, in order to ensure that the needle or scalpel finds the correct spot on an internal organ, image guidance will be used. So we need to check what is the purpose of imaging guidance so that we can understand. Next code we have 10005 fine needle aspiration biopsy including ultrasound guidance first lesion. So so basically we have four types of imaging guidance here. First one is ultrasound guidance, fluoroscopic guidance, and CT imaging, and as well as MR guidance. Using these four modalities, physician will perform the fine needle aspiration. So 10005 fine needle aspiration biopsy, including ultrasound guidance, first lesion. So here physician will use ultrasound guidance, and 10006 is for each additional lesion. If the physician performs three lesions biopsy, aspiration biopsy, we need to go code 10005 first, then 10006 twice. As it mentioned here, each additional lesion means based on number of lesions, we need to code 10006. So here 10007 fine needle aspiration biopsy including fluoroscopic guidance first lesion. This is also same like ultrasound guidance. Here also for first lesion primary code is 10007. If the physician performs second lesion, we need to code 10008, which is a add-on code. So third one modality is 10009 fine needle aspiration biopsy including CT guidance. First lesion. So for second lesion, we need to use 10010 each additional lesion. Next, we have 10011 fine needle aspiration biopsy including MR guidance. MR guidance means magnetic resonance guidance. This is for first lesion, and second lesion we need to use add-on code 10012. So here we are going to know few technical tricks and tips here. If two different biopsies using different imaging modalities on different lesion, use the primary code for each one with 59 on second. If FNA and core biopsies are done on the same lesion, same session, same day, same type of imaging guidance, Do not separately report the imaging guidance for the core biopsy with modifier, as here it is mentioned same type of imaging guidance. For example, 10007 fine needle biopsy including fluoroscopic guidance, first lesion. So second one is biopsy of 19100 59 modifier, biopsy of breast percutaneous needle core not using imaging guidance. So here physicians performed FNA on breast and core biopsy on a breast. So here we will not use imaging guidance for 19100. So report the core needle biopsy code without any guidance. The same guidance should not be reported twice. Because of that reason, we will not use modality or imaging modality for 19100. If fine and core needle biopsies are done on separate lesion, same session, same day, same type of imaging guidance, then report both types of biopsies with imaging guidance with modifier 59 and second. So I think you have understood this session. If you have any doubt, feel free to send me message to fastcoder21 at the rate gmail.com. Thank you. Happy learning.